Well, hello to my fabulous colleagues. Dietitian Ashley Koff here. If you don't know me, I've been doing this for about 25 years. I'm the founder of the Better Nutrition Program and a weight health expert who has been working in the space of GLP-1 really not since in school, because I didn't learn about any of this in school, but since I had my first bariatric patient and then went on to work in bariatrics as well as working in weight health, as a dietitian starting in like around 2003, 2004 on that part. So we're here today because you have just had exposure. Perhaps the email is actually your first exposure and introduction to Calocurb, to the evidence-based information, to this exciting new information, that evidence that has been published in Obesity Pillars. I invite you also to check out all of their research. This is a research-led initiative by the New Zealand government that led to the identification of this ingredient and then the applications that we're seeing and that I'm going to talk to. It was actually the research. We're evidence-based as practitioners. It's the research that led me to want to be able to test this out with my patients. And what I'm seeing is several areas of opportunity, and I wanted to talk to you about them. I'm going to keep this short so that I don't go on for too long, but I also wanted to invite you. I do have I have a protocol package for looking at GLP-1 activation and sort of how you navigate these different choices with your patients, and then patient resources, et cetera. And I have that available for you. And then also at the Better Nutrition Program, we have our toolkit, and our toolkit this month is including, actually starting in October, the tool for that month will include, the topic is how to help your patients go off of, or to trial, to experiment with going off of a semaglutide or a tirzepatide, and what that 6 months will look like. And Calocurb is a big part of why I'm feeling much more confident about being able to do that. So let's look at the three applications. Before I do that, I just want to recap that Calocurb exists on a continuum of resources for helping us to support the body's natural processes, which includes what I call the switch, your metabolic switch of CCK, PYY, and GLP-1 hormones. And on the far end, we have semaglutide and tirzepatides, which work 24/7 at a higher amount. I like to say they're like the 4 shots of espresso that you're getting in, but they're staying on 24/7 for about 7 days, whether it's the shot or the oral. There may be newer versions that come out. This is September of 2024. And they stay on for 24/7. And so that's important because on the complete other side of the continuum is what the body should naturally be doing, which is producing and deploying, we produce in the L cells, the lining of our digestive tract, these hormones, and deploying them for about 2 minutes, anywhere from 2 to 30 potentially minutes before they're degraded by enzymes. And so that's the natural side. And there are ingredients that help to support the natural production of those hormones. So things like different probiotics and prebiotics and postbiotics, and there are things like berberine and other ingredients that we may hear about, but they're not nature's Ozempic. They literally are on the helping with the exact opposite side of Ozempic or Wegovy or Zepbound, et cetera, on that part. And then Calocurb sort of holds this space itself in the middle. It is the only ingredient so far that I've seen, and again, this is research based, that goes above that threshold of about 400% activation to achieve about 600% activation per the research. Thus, it's called a GLP-1 activator. So it's not like part of the support system; it's activating. And in doing that, it lasts for about 4 hours. So it's activating at a higher level and it's staying around for about 4 hours. And thus, in an 8-hour day, that's why the recommendation is 2 capsules twice a day, spread out around this 4-hour time period. And it's why the suggestion is to give your body about an hour before food to be able to take this. I will say anecdotally, I do have patients who have experienced the benefit. I personally have taken it and experienced this where I forgot and I took it like right as I was eating. So it may not be as effective in that space, but it certainly lasts for the 4 hours. So it did prove helpful for me, and And, I've seen that, clients have said like, it's like, it's okay. It's still, it's still okay on that part. What's not okay is to have somebody take one a day. You do that in the very beginning as the onboarding, but to sustain that. And so compliance and just, having that conversation about how to take it is going to be really important. So the 3 areas that I can see this being really helpful is for someone who needs the benefit of and is interested in help with helping to feel full faster, helping to stimulate their insulin response, and helping to calm some of the food noise, the cravings. This can be very helpful, and especially for that person where, for a variety of different reasons, a semaglutide or tirzepatide isn't the better choice, or isn't even an available choice, whether it's cost, whether it's their health, whether it's, just a variety of different things. So again, love it. Been seen with my patients. They're very successful, and am enjoying that. Times that I like it, it might be very helpful for somebody who maybe deals with before their period, just an increased amount of need there. And also even, let's get over to the space of somebody who wants to be or is choosing to be on a semaglutide or a tirzepatide, but wants to be at a lower dose, and is able to use Calocurb as a balance there. And that's something that I've been using for people who are microdosing, and it's also something that I've been using for people who are just maybe have side effects and just shouldn't be increasing, their intake. That's a little bit easier to navigate when we're using a compounding version, but we can still do it with the lowest version of the shot, or even the middle version of the shot, and amplify the results that people get. And also, especially to help them where most people are saying that by day 5 of 7, they see a significant reduction in the effect of their medication. And so perhaps you're using it more on that day 5, 6, 7. And then the third area is, can we come off these medications? And my answer there is a maybe. First of all, do we need to? Again, it's a maybe. There are so many things for us to consider, and we want to remove, I think as practitioners, judgment around this. It's like a statin medication, it's like taking thyroid hormone, et cetera. But what we do want to understand is that if we just come off of a medication that was doing something externally by coming in and providing 4 shots of espresso, keeping something that's normally on for 2 minutes, on 24/7, and we haven't fixed the internal side, no wonder there would be weight regain or blood sugar rebound, et cetera, on that part. So we really want to do a tactical plan, over the course, and ideally in my world about 180 days, to be able to reduce the likelihood of that regain, and also to set very clear parameters for measuring weight regain, blood sugar regain, whether using a continuous glucose monitor, using a scale, maybe using a bioelectrical impedance analysis, BIA, like an in-body, that kind of thing. And I set it at, I'm pretty rigorous, 5 pounds, in that regard. So that as I'm implementing my protocol there, I want to make sure that somebody is not going above 5 pounds, so that I'm, I find it, quite frankly, very disappointing to see that there's, research where people are saying, somebody regained all of their weight. Where was the intervention? If somebody lost 40 or 50 pounds, where was the intervention at 5 pounds, at 10 pounds, on that part? So to me, these are the places where Calocurb is just, such a great tool as we're reducing the amount of medication, and as we're doing the work to support the body's natural production, to be giving it this activation, that can be really helpful in ongoing maintenance, and that may be for life, in that part as well. So I hope that this has helped you to sort of think from a clinical standpoint and understand my experience as a clinician, and would love to welcome you to check out the resources that we have. We'll share that link, and if I can be more helpful, please don't hesitate to reach out. Thank you.